everyone to the 4 o'clock presentation. I'm a little biased. I think this is the best presentation that you will attend at 4 o'clock. And we're really, really, really lucky to have Luis Herrera Perales, who's here to present. Luis is coming from the Public Health Seattle and King County. So thank you, Luis, for presenting on the topic. And the topic is sexual health in primary care and an introduction to Latinx representation in healthcare. Super important. So with that, Luis, I'm going to turn it over to you. And like we chatted about, for all those students who are here, if you have a question as Luis is presenting, add that question into the chat. And Luis has given me permission to politely stop him, and I will interject with the question. So with that, Luis, the floor is yours.
Awesome. Hello, everyone. My name is Luis Herrera. I use he, him pronouns, so feel free to address me with those pronouns. I am very excited to talk to y'all about my presentation today. So let's see, I'm gonna share my screen. Can I just get some verification that folks can see my screen?
Yep, we can see it.
Perfect, awesome. Let's get started. So, a little bit about what we're going to talk about today. So I really wanted to highlight and have this opportunity to talk to folks about representation in healthcare. I grew up in a community where there weren't very many Latinx doctors, nurses. So I really think that I want to take this opportunity and talk to folks about various opportunities that there is to work in healthcare. And it may not necessarily be as a nurse or as a doctor, but there are different levels in public health that representation is very helpful. So I'm going to talk a little bit about that. I'll talk about myself and my experience in healthcare. We'll go over some sexual health basics. I don't think anything that I will mention today is going to be new. Washington State has a really great sexual health programming in their schools. So hopefully nothing is new, but feel free to ask any questions. I'll talk a little bit about my specific program and my project that I'm working on with public health. And at the end, we'll play some Jeopardy based on what we talk about in the sexual health basics. So folks, pay attention. Okay. Our goals are going to be to just highlight the importance of representation in healthcare. We're going to review sexual health care basics and identify local resources folks have access to take care of sexual health needs. So a little bit about me. I grew up in Idaho. I'm actually a DACA recipient, so Deferred Action for Childhood Arrivals. So for the majority of my life, I grew up undocumented. And it was an interesting journey because if I were to ask my 12-year-old self where I would be at my age now, I could not imagine where what I've been able to do, the schooling that I've been able to achieve because of my immigration status. So I think it's really important to find folks that y'all can relate to, whether they have similar identities as you or not. But for me, I didn't have someone that I looked up to who had very similar identities as myself, and especially in healthcare. Before I took this journey to healthcare, I actually was doing a lot of community-based work. So organizing labor union stuff. I actually graduated with my bachelor's in political science, and I thought I was going to go to law school. With all the different role models I had in my life at that point, attorneys who were Latino kind of took me in that direction. But after my parents became legal permanent residents, I kind of, and my brothers and sisters all have DACA, there was a moment where I realized that maybe I was doing this more for my parents than myself. And around that time, I actually started doing some community-based work at Gay City, Seattle's LGBTQ center, and specifically in their sexual health wellness center. And that's where I fell in love with the work. So I've been working in sexual health for about 3 years. Started at Gay City, and it was just a random thing that happened. So it was really interesting to see that I enjoyed it as much as I did. So what I do now is I'm a disease research intervention specialist for the public health department here in Seattle, King County. It's a fancy title for saying that I focus on sexual health. So what I do is actually, I'm a phlebotomist. So I draw folks' blood, do some counseling around sexual health. And when necessary, I kind of triage folks to either our nurses for some treatment for STIs or our providers to prescribe some medication. And this fall, I'm going to get my master's in public health. So learning never stops. And I think I'm really fortunate and grateful to be on this journey as I move forward. So a little bit, I mentioned at the beginning, we're gonna just kind of go over some sexual health basics. Hopefully nothing's too new here, but I just want to set us up for a Jeopardy game that we'll be playing here towards the end. And there's about 12 folks on the line or on the Zoom call. So feel free to stop me if you have any questions, or if you have any questions a little bit about my background. What I will say to wrap that up will be, there are so many types of work that you can do, especially in public health when we have our clinical types of jobs, such as nurses. We have our doctors. On the other end as well, we have a lot of healthcare providers working in public health that kind of oversee some more of the administrative pieces of providing an overall healthcare for folks. And my position is a pretty hybrid type of position, because I not only see patients, I do some sexual health counseling, draw folks' blood, at the same time that if there are folks who need extra support, because there's issues at the pharmacy, there's issues with the insurance company, nurses and providers don't usually have the time to kind of go through and figure out those issues with patients. And mostly because I think a doctor's time and a nurse's time is really valuable, because the more people that we're able to see, and the more that we work as a team in healthcare, overall brings better health outcomes to folks' lives. So let's start with the sexual health basics. I think the most important thing to just start with is sexual health, especially in my day, wasn't something that folks like really talked about, which a lot of the fear created some of the stigmas that kind of just keep us from doing our best in treating folks and getting folks taken care of. So the very first thing that I want to talk to folks about is kind of just like fighting against stigma in sexual health. And two main ways to do that. One is like talk about your sexual health. Normalizing talking about health, your health in general, and specifically your sexual health, I think is really important. Growing up, there was no one really that I had access to ask these types of questions. I didn't see a primary care provider until I was like 22, and I think that for me kind of impacted why I like to do a lot of this work, is because it's really interesting to see, to meet folks who are coming in for the first time testing, and they're scared and terrified. And I think that here in Washington State, I have not experienced sexual health programming, but from what I've read about what folks review, I think is really powerful, really meaningful, especially as you get into your young adult life, that knowing some of these concepts, understanding what resources you have access to is really important. And it comes down to just talking about sex with your friends, folks you trust, especially, and knowing your rights when it comes to your sexual health. And in the state of Washington, folks who are youth, so folks between 14 and 18 years old, have the right to seek their sexual health care without consent from a parent. So if what I don't want folks to be is to be scared of asking for help, and just know that you're covered to ask for help, ask folks that you trust, especially in your schools, to get the care that you need. And the second part of it is once you've come to terms with sexual health on your own, taking some action around combating stigma is folks who are stigmatizing, that's where destroying stigma will start, is you get informed, go get tested. Different things that you do to inform yourself can reduce stigma, especially when it comes to stigma for HIV and STIs, right? So getting informed, asking the questions, and the whole taking apart stigma will starts with individual folks. And a good example of that is when folks talk about the language folks use is, instead of saying that person has HIV versus this person is a human who is living with HIV. So just thinking about how you talk about folks, how you refer to folks, just thinking about they're a human first, no matter what their condition may be. And identifying risk reduction methods, and we'll talk a little bit about those more in depth, that work best for you. So you knowing what your boundaries are, you knowing what you're willing to accept for yourself, I think is very important. Perfect. So in thinking about sexual health risk reduction, there are so many tools that folks can use for yourself to kind of reduce your own risk. And I often tell folks the most power that you have is with yourself and your body, and that's a power that folks can't take away from you. So there are different ways to reduce your risk for STIs and HIV, and part of that is getting tested and treated. So if you know your status, talk about being open when folks ask, right? So getting tested, knowing your status, asking your partners what their status is, all different things that have been proven to reduce folks' risk of getting other STIs or HIV, using condoms or other barriers, taking PrEP. And I'm not sure if PrEP is in the curriculum right now for school, but we'll talk a little bit more in depth about this method. But it's a pill that you can take once a day, and it reduces your risk of getting HIV. But it only works against you're reducing your risk against HIV. So some of the other STIs that are out there, you can still, if you're not using any other method to reduce your risk, you're still at risk for. And if folks become HIV positive, there is treatment that one can take to manage that infection. And I think the most important thing is just taking care of yourself and talking take into consideration like what your boundaries, what you're willing to put up in relationships, and how you define relationships. Like that makes yourself so much more powerful, especially as you move forward in life. Something that you'll continue to learn is just create appropriate boundaries for your own health. And so something that I want to highlight is the different resources that folks have access to. This isn't an exhaustive list of resources, but these are places that I've worked at or work with currently. Towards the end of the slideshow, there is a resource slide with like a phone number, link to the organization's website to make an appointment. So Gay City, I worked there for like 2.5 years. Such a really great organization, and a welcoming space to for folks, not only for like sexual health, but also really great community space to be yourself in. Currently, I'm actually at the sexual health clinic here at Harborview, with an amazing view by just as an FYI. But here, like we're able to see all different populations for folks for testing. Like here, no one will ever get turned away when they're coming asking for help. And it's really important for folks to advocate for yourself. It's one thing to come in at 5:55 when we close at 6, but just know that coming here, getting services, like we're a public health site, so there should never be a barrier for you to access any sort of resources here. And I actually work at 2 clinics. So the other place that folks can go for is our public health primary care clinic at Navos in Burien. Similar philosophy, right? We're located outside of Seattle. There are other primary care sites as well as part of our public health network, but this one is the one I work at. Again, resources, there's a page for resources where folks can get our number, give us a call if folks want to schedule. What I will say though for the public health at Navos, and we'll talk a little bit more depth about it, is our clinic is actually an adult clinic. So folks do have to be 18 years or older to seek care at our Navos Public Health Clinic. And the best place to start is if you do have a primary care provider, especially if you feel comfortable talking to them, if you've talked to them about other concerns that you have, that is always going to be the best place to start, or start building that relationship with your primary care provider. Right now, the primary care provider that I have is amazing, and I value this person just so much because I can go to them for anything, whether it be sexual health or anything, or any other need that I have. And I think that's where our clinic at Navos kind of is unique in a way where part of my work there is not only sexual health, but like also connecting folks with primary care. So I'll share this out with folks, and they can distribute those resources, but definitely there's always a place that you can go to get any sort of help that you may need. So always keep that in mind. A couple of the sexual health basics that we're going to just go review. I'm just going to go over a lot of the things that I see on a day-to-day basis. So hopefully nothing is really new here. So these are the main STIs that I come in contact with in my work. So gonorrhea and chlamydia, syphilis, and HIV. So a little bit about each of those. Literally, each of these topics can be a whole hour presentation on their own, but we're just going to cover a couple points for each of these. So like gonorrhea and chlamydia, it's a bacterial infection. It's multi-site. So you can have it in one place and not another place. So it's really important to as you have a sexual health consultation with your provider, to just be as open as you're willing to be to talk about your health, and that way they can determine what type of testing will fit you the best. But gonorrhea and chlamydia often get asked is, hey, like, is it treatable? Is it going to go away? And the answer is yes. But that does not mean that you can't get it again, especially for gonorrhea, chlamydia, and syphilis are all infections that are treatable, will go away, but you can keep getting them. But going back to the different methods that you can own to reduce your risk, again, like routine testing, especially if folks are more sexually active, taking the time to take care of yourself is really important. And then we have HIV, which is a virus. It's tested usually through a blood sample. And this is one of the infections that isn't curable, but we've come up with ways that we can manage folks who become HIV positive. So I wanted to share a little bit of a report for Washington State. So this is a Washington State report that came out for the most recent one isn't available yet, but between 2018 and 2019, this is kind of how the infections broke up within the state of Washington. And you, on the far right, you'll kind of see the trend and an up arrow. I wouldn't be too alarmed about that, and I think it depends on who you ask. I think there's multiple things that that takes into consideration, and I think one of the things that like helped me make sense of that is as we increase testing, as we increase like accessibility to testing, folks will get tested more often. Folks who have never tested before we're able to test them, and that might add to the numbers that we're seeing. And not for any negative, it's just we're doing much better jobs at identifying cases, getting folks treated, getting their partners treated, and that's really important as we combat like STIs here in Washington State. And next is just brief HIV. So AIDS versus HIV, and I'm not sure how much in depth folks go over, but something in light of COVID, something that kind of I've used to kind of help folks understand what the difference between HIV and AIDS is when we talk about COVID, we know that there's the SARS COVID-19 infection. So folks get the infection, which is SARS, and then when folks start becoming like symptomatic, and when we hear COVID-19, that's when we know that the infection has progressed to its stages where folks are getting sick. So when HIV is when folks gets infected with HIV, that's how we talk about what HIV is. But when folks are like not treated and they're not tested, so they don't know they have the infection. If we're not managing the infection, HIV progresses into being to becoming AIDS. So it's just kind of for folks as information, it's one infection, but HIV AIDS is the progression of an HIV infection without treatment. The first case in Washington State was 1981. That was the first documented. Probably there were probably others, probably even sooner than 1981. But the Department of Health has that date as when they first diagnosed someone living in Washington State with HIV. And like I mentioned before, so HIV is not only preventable by different methods, right? Getting tested, using condoms, taking PrEP. But if someone does become HIV positive, I think the most important thing to know is that people living with HIV, if they get connected to treatment, they start taking medications, can live long, healthy lives. We're definitely in a different time now where folks aren't dying due to lack of, at least in the United States, with not having access to different resources. And especially here in Washington State, where we do a really good job at getting people tested. And when we do identify infections, we get them connected to different resources. And in the state of Washington, no one who's willing to access resources would be turned away, depending despite things like immigration status, despite whether they're insured or not. There are different resources in the state of Washington to get folks treatment. So Washington is a really good state, and has been able to manage infections not only for STIs and HIV in a completely different way than I would say in my home state of Idaho. But when folks reach undetectable, something really important to know is that folks who are undetectable can't transmit the HIV virus sexually. So folks maintaining their medications, taking care of themselves, not are only going to live a long, healthy life, but they'll stop the spread, and the spread of HIV will stop with them, especially when they have reached a status referred to as undetectable. And this is just some of the information, some of the data for 2019 around HIV cases. And new HIV cases in 2019, there were about 410 new diagnosis for HIV. And in this chart, folks can't probably see it too well, but something that I want to highlight, and I think is really important to me, is kind of the work that I'm able to do in the Latinx community, because Black and brown people of color, are at higher risks of getting HIV. And I think that's where I find my work really, really valuable. But when we look at why our Black and brown people have higher rates of HIV infection, is not because this population, there's just more infections with these populations, because in relation to their population size. So I believe here we can see Hispanic folks, there were 97 infections in 2019. And their population was being infected at a higher rate than white population. So their rate is higher, even though the number of white folks who were infected with HIV, the actual number was larger. And that's part of what we talk about, just because if a small community gets infected with an infection, it's easier spread within a small community than a larger community. So the rates of folks being infected with HIV are higher in smaller populations than in larger populations. And quickly about PrEP. So I mentioned PrEP here a couple of times, just a couple points around that. PrEP stands for pre-exposure prophylaxis. There's actually 2 medications that have been approved for the use of PrEP. PrEP is taken before you're exposed to HIV to reduce your risk of getting HIV. folks who are ages, a new law that happened. I'm not sure if it's taken effect, but folks starting like at 14 can not only seek sexual health resources, but can take PrEP to reduce their risk of HIV. PrEP was approved in 2012 to be used as prevention, and since then there have been a lot of great resources here in Washington State, especially to support folks to get on PrEP to kind of support our mission of ending HIV in Washington State. A couple of main things that you should know about PrEP. I mentioned this before. PrEP is a medication that you can take once a day, and it's used to reduce your risk of HIV and only HIV. So other STIs, gonorrhea, and chlamydia, syphilis are still infections that folks can get. And no matter what your ability to pay is, there's always a way to cover PrEP for folks. So if someone is interested in PrEP, cost should be one of their last concerns, just because a lot of resources here in Washington State to help folks get covered for this program. And PrEP works really, really well. It's one of the best things that we have gotten, in addition to like condoms, more other risk reduction methods to kind of just really fight back against HIV. Okay. So a little bit about our program at Navos. We recently received a grant to kind of increase access to testing, access to PrEP, and increase the utilization of primary care in South King County. So that's part of like the work that I do, is I do testing for folks and support folks with accessing PrEP. At our public health site, folks can receive any other service for primary care. Like I mentioned before, it is an adult clinic, so folks aren't 18 yet. Like this is a place among a bunch of other resources that folks can go to get some support. And just some of the key takeaways again. I think that representation in healthcare is vital for like our community health. Fighting stigma, like that's always going to be a way that we can reduce folks' exposures by just talking about sexual health and resources to get tested, treated, anything that folks may need. And this is the resource site that I mentioned. So I will make sure that gets out to folks of different places that you can go get tested or get treatment, anything that you need. These places can help.
And Luis, this is Christina. You're doing a great job. Just want to give you your 5-minute warning, and also students in the chat. Kate put in, make sure to complete the form. It's a Google form prior to the end of this presentation today to get credit for being here. And back to you, Luis.
Perfect. So sexual health jeopardy. So I just wanted to open it up. I'm gonna, just to get some of these answers or questions answered, I'm just gonna open up a couple, but if folks can participate and ask some questions. I'm gonna start with sexual health for 50 points. Someone who is HIV positive and undetectable cannot infect another person through sex. Is that true or false? It is true, right? So someone who has become HIV positive but is taking care of themselves, taking their medication, there's a 0% chance that they can transmit HIV to their partners sexually. Let's do another question. Asking your partners their status will help you reduce your risk of HIV. And that is also true. Asking your partners is really important, having a dialogue, and just being as open that you feel comfortable being. all of that, all of those things like will help yourself take care of yourself, your body. You only have one body, and there are different ways to that you can take care of that. Let's do another. I provide primary health care to children, including immunizations, well baby checks, school physicians and treatments, coughs, colds, and stomach flu, among other things. What type of doctor is this? It is a pediatrician. So folks usually see pediatrician in their younger years for their healthcare needs. Yeah. And any questions, I'll leave the rest of the time for folks if folks have any questions that they want to ask.
And we can go until 50 after the hour if you would like more time.
Okay.
I just got confirmation.
Yeah. Okay, cool. I'd definitely like to hear from folks if folks have any questions, if they would like clarity on anything that I just went over. I'll skip to, can I skip to the next slide? Another question, when was a year that Washington State first reported their first HIV infection? It was B, 1981. But let's go to final question. And I'm gonna go to just the slide with my contact information for folks, if folks have any questions. But wanna open it up to folks if folks wanna ask any questions.
And students who are attending, you can either add them in the chat or you can just unmute yourself and ask away.
Yeah, so a couple of things that I think for me to highlight are, you may not have to have everything figured out now. Like for myself, again, I thought I was going to be a lawyer, but changed trajectory, and now I really enjoy like a lot of the work that I get to do with communities. And you don't have to have everything figured out right away, but look at me, I'm going back to school to continue doing a lot of the work that I enjoy.
Luis, I'll ask you a question.
Yeah.
So maybe what was the most challenging thing when you made that move, like from going from, you know, thinking about being a lawyer to then going into the healthcare world? Like what was the most challenging thing for you as you made that change?
Mm-hmm. I think the hardest thing for me was that there was a gap of time where I had made the decision law school is not for me, and I was figuring out what I wanted to do next. During that time, I was actually working for a labor union, so doing a lot of work around minimum wage work here in Seattle. And my time there was kind of just like wrapping up, and I knew I didn't want to go to law school. I knew that I was exhausted from doing a lot of the labor organizing. I think the hardest part for me was, where can I find like joy? Where can I find happiness in the work that I do? Not that the work that I was doing before wasn't bringing, wasn't important, but for my happiness, it wasn't there. So for me, the hardest part was the in-between time of like realizing something about myself and then finding something else that I really enjoyed doing. But I will share out this presentation for folks. A lot of really great resources for folks if they are seeking any sort of local support around sexual health. Please always ask, especially folks that you trust, and ask for support.
Great. And thanks, Luis, so much for your time and your expertise on this topic, which is super important.